Anthony Fauci says the Pfizer vaccine candidate efficacy is, quote, extraordinary. Dr. Schaffner, your take.
I think it's extraordinary. None of us expected anything like that. I would have been delighted with 70% effectiveness. Here we have 90%. Now, it's still early days. We don't exactly know how effective it is going to be in older persons. We don't know, as Michelle said, whether it protects against severe disease. But we do anticipate that if it prevents infection, it also will prevent serious disease. And we have to watch it for a longer period of time regarding its safety. Once it starts to be used in the general population, the CDC actually has mechanisms to keep assessing its effectiveness and safety as we start to open it up and use it in the general population. That should be very, very reassuring to the general public and to the medical professions. So I'm guardedly optimistic that maybe by December sometime, we could start vaccinating the first people who are in the priority group, and they will be healthcare workers.
Obviously, that would be huge and very welcome. One thing that stood out to me, though, is that it said that the companies will be able to produce enough doses to inoculate just 650 million people. That's less than 10% of the world's population, and that's by the end of 2021.
Well, certainly no one company can do it all immediately, and that's why we hope that there are going to be a number of different vaccines, not only for our own population, but for the world's population. Another little caution, this vaccine requires 2 doses, and it really is an ouch vaccine. It hurts going in, and the second dose hurts more than the first by and large, and you can feel kind of crummy for a day or so. So we will really have to let everybody know what to expect and persuade people to come in for that second dose.
That's interesting. Do you really feel like that's still going to be, well, not still, is that going to be an issue, getting people to come in, really?
Oh, yes, because at the moment, the surveys would indicate that about half the population is going to stand back and watch the first group get vaccinated to be sure that everything is going all right. We're going to have to really provide a lot of reassurance and information to get people to, when it's appropriate for them, get in line and roll up their sleeves.
If there was a demand, if all of that was there, what are still some of the logistical issues that companies like Pfizer need to be addressing, or is it also the logistic companies that have to be addressing things right now?
Well, Pfizer is in large control of its own logistics. They're doing it independently, and they have special issues in shipping and handling because this vaccine is fragile. It has to be kept very, very cold, and people have to be trained in how to give it so we don't waste vaccines, because once you go into a vial, you have to use those doses quickly, otherwise the vaccine degrades. So we will have to organize how to give this vaccine. State health departments have been working on all of those plans for a month, and so they're largely in place. Education is ongoing where this vaccine will be given. Remember, the first group are healthcare workers, so it will be given in the context of medical institutions who know how to handle these kind of fragile products.
That's a good point. And before we go, this was obviously the vaccine developed by Pfizer and BioNTech, but there's lots of other ones out there as well. Novavax, also their vaccine received a fast-track designation from regulators today. Where are the other guys? How are they stacking up?
They're all in line, one after the other, so we could anticipate over the next 6 months or so one vaccine after another coming to the fore, and this one gives us real optimism that the others likely will work also. We'll just see. Perhaps one vaccine works better in a subpopulation, older people, for example, than another vaccine. We'll have to see all that down the road.